you have diabetes and access to diabetes technology, you surely have a lot of this. Data. When thinking of data, you probably think Diasend. Well, no anymore thanks to Dexit. Since my diagnosis over 10 years ago, Diasend has been a fundamental part of my care, as it is the tool used by nearly all healthcare professionals to review data. Over the past couple of years, Diasend has been phased out and slowly replaced by Gluco. Similar tool, but with a modern take on analyzing data and making decisions. Gluco is about to get a major upgrade, so I sat down with Gluco's Chief Medical Officer, Dr Clements, to find out more about Gluco, their values, and their plans.
It should take less time to access the software systems, right? With less context switching from system to system. It should also take less time and brain power to interpret the data. So we have thought long and hard at Gluco about how clinicians think and have really patterned the reports that we provide, for instance, to follow the decision-making heuristics of a multidisciplinary diabetes care team for our clinician portal and for the person with diabetes. If we can reduce the burden on the provider team, that gives back the gift of time to the person with diabetes and their trusted provider so that they can look each other in the eye and communicate about what's important. What we hope to see in the future is the ability for the user, whether it's a person with diabetes or a member of their care team, be able to customize that view even more, because even if we design what we think is the best flow of information, right, starting at a 10,000-foot view and drilling down into more and more detail until you get to, this is what you should change when you play soccer on Thursdays. Sorry, I'm from the US, we call it soccer.
Call it wrong. Yeah.
Yes, exactly. We've really thought about how to do that. What we want to do is recognize that even if most people want it in a particular way, there is a lot of variability, and that we can probably design a product that will allow people to surface information in the unique way that they want to see it.
I think earlier you mentioned the term precision engagement. And I just wanted to ask you, what does that mean?
Sure. In pharmacologic medicine, pharmaceutical medicine, for a long time, we've had this term called precision medicine or personalized medicine. The definition of that has been that as a clinician, I can tune the drug dose to your unique genetics, your unique metabolomic profile. But as an endocrinologist, I've always felt a little bit dissatisfied with that, because first, diabetes was the original, precision medicine disease, right? We give insulin when and how you need it in the dose that you need it. We've always given it that way.
Right.
But we know that with diabetes, as with other chronic illnesses, that there is only there's only 10% of the disease management that involves managing the physiology. The other 90% involves managing behaviors.
Right.
And that's the individual with diabetes managing their own behaviors and how they incorporate the diabetes into their identity, into their daily habits. That includes the habits of the providers, the clinicians and the diabetes care team members. What are they doing at the healthcare organization that are, what behaviors are helping to promote, your health? So I think that precision engagement means finding the right time and just the right way to nudge behavior for any of these players in the ecosystem. So could I identify, for instance, the right moment of the day to suggest to you that now might be a good time to eat an apple and take a walk? because you're the most receptive to that suggestion compared to any other time of the day? Could I identify just the right way to say it? Perhaps you're an individual who really responds to more authoritative directives, or an individual who responds to humor or responds to empathy. Can I figure out the tone of voice that I should use and the psychological theory that I should use to select the language that I'm going to put forward to nudge that behavior? So precision engagement is, just the right behavioral intervention in tiny doses at just the right moment for just the right person.
I am intrigued by precision engagement. As we all know, 99.99% of diabetes happens outside of the doctor's room. So I welcome this new approach to engaging. Although this is one of those new technologies that has to prove itself in the real world, not just on a PowerPoint presentation. Redesigned Gluco has just entered its limited beta with full public launch coming next month in selected regions. If you get an opportunity to try it, let me know your thoughts in the comments. I see you at the next one. Bye bye.